Hi friends, welcome back to the channel. I am Dr. Help, your favorite vet who sometimes talks about more than just dogs and cats. Today we are diving into something serious, but I promise you won't be bored. Let's talk about Lassa fever, a virus that has been making noise across Nigeria, West Africa, and even got the UK on alert recently. What is Lassa fever and how is it transmitted? Lassa fever is caused by the Lassa virus, a member of the arenavirus family. It is a zoonotic disease, meaning it is transmitted from animals to humans. The primary reservoir host is the multi-mammoth rat, which is widespread across West Africa. These rodents share the virus in their urine and feces, contaminating surfaces, food, and household items. Humans become infected when they eat contaminated food, use utensils, or touch surfaces contaminated with rat poop, or inhale airborne particles from rodent waste. So basically, one bite of contaminated garri and boom, welcome to Lassa fever club. Now let's talk about the human-to-human transmission, especially in hospitals. Although the disease begins in rodents, it can spread between humans, particularly in healthcare settings. This usually occurs through direct contact with the blood, tissue, secretions, or excretions of infected individuals. Health workers are at particularly high risk, especially when personal protective equipment (PPE) is inadequate or unavailable. A powerful example is that of Dr. Divine Njadze, who contracted Lassa fever in early 2024 while treating a patient without gloves during an emergency. He developed severe symptoms and was hospitalized for over a month. Despite the challenges, he survived and returned to continue treating patients, a testament to the commitment of many frontline workers. Can you imagine treating others while you are also sick? That's hero level stuff. Now, let's take a closer look at the statistics. In 2024, Nigeria recorded 1,309 confirmed cases and 214 deaths from Lassa fever. Within the first 6 weeks of 2025, there was 1,913 suspected cases, 413 confirmed, and 80 deaths. From 2022 to 2024, 105 healthcare workers were infected, with 83% of cases occurring during the dry season, that's during January to March. These numbers highlight not only the scale of the outbreak, but also the occupational risk faced by health providers. In Nigeria alone, over 1,300 cases were confirmed in 2024. 214 deaths recorded that same year. By March 2025, another 413 confirmed cases and 80 deaths were already reported. The WHO ranks Lassa as the top animal virus likely to jump to humans, even ahead of Ebola. Every year, Lassa infects up to 300,000 people across West Africa, with thousands of deaths. Now, here is the burning question. Can this be prevented? There is currently no approved vaccine for Lassa fever. Treatment relies heavily on supportive care and the use of ribavirin, an antiviral drug that is most effective when administered early. However, delays in diagnosis and treatment access remain significant issues. Encouragingly, clinical trials are underway. A candidate vaccine supported by the Coalition for Epidemic Preparedness Innovations (CEPI) underwent phase 2 trials in Nigeria in 2024. Research suggests that a safe, effective vaccine deployed in 15 15 West African countries could save over 3,000 lives and over $128 million in societal costs over 10 years. Now, Lassa fever is also a growing global concern. Yes, in March 2025, a traveler who returned to Nigeria after visiting the UK tested positive for Lassa fever. While the risk to the UK population remains low, this incident underscores the potential for international spread and the need for global vigilance. The UK Health Security Agency has responded quickly, tracing contacts and providing medical advice. How can you stay safe? Keep your environment clean. Store food properly. Rats love exposed grains. Wash your hands regularly. Avoid contact with sick people's body fluid. And please don't ignore symptoms like fever, bleeding, vomiting. Get tested early. In summary, Lassa fever is a serious zoonotic disease that originates in rodents and can spread to humans, particularly in hospital settings. It poses a significant threat to health workers, many of whom operate without adequate protection. Although there is no licensed vaccine yet, efforts are underway to develop one, and early treatment with ribavirin can save lives. Improved hygiene, early diagnosis, PPE access, and vaccination remain key strategies to reduce its spread. As veterinary professionals, public health workers, and citizens, we must continue to support awareness, research, and response to efforts to protect communities and healthcare providers alike. Thank you for watching. Please consider sharing this video to raise awareness and encourage prevention. Stay informed, stay prepared, and stay safe. Subscribe for more content on animal health, zoonosis, and public health. And the links to the resources are in the description below. Stay tuned for more educative videos. Thank you.